Stroke is a medical emergency that could result in debilitating consequences like lifelong disability or even death. That's why urgent and adequate medical treatment is required in order to save the sufferer from these consequences. You're welcome again to this channel, Dr. Ayukes. I'm still Dr. Ayobola Ogunbanjo. Today, let's talk about how to modify your lifestyle to prevent a stroke. So here are some of the ways you could prevent a stroke. Stroke happens when there is lack or loss of blood supply to the brain, which could happen due to so many reasons like underlying medical illnesses, high blood pressure, diabetes, or certain lifestyle that predisposes to the obstruction of the flow of blood to the brain. So let's get to it. Here are some ways you could modify your lifestyle to even prevent a stroke. Number one, maintain a healthy weight. Being overweight or being obese is a risk factor for both high blood pressure and consequently a stroke. In obesity, the adipose tissue, that is body fat, is in excess. This adipose tissue, they have metabolic needs. Therefore, the heart has to work more. As a result of this, there's increased cardiac output. So when there's consistent increase in cardiac output as a result of trying to make up for the metabolic needs of this adipose tissue, there will be constant increase in blood pressure. And high blood pressure is the biggest risk factor for having a stroke. Also, obesity could cause fat, cholesterol, and some substances to build up along the walls of the artery. When they've accumulated over a period of time and they are now big enough to obstruct these arteries, this reduces or even stops blood flow to the heart, to the brain. So when this fat obstructs the artery that supplies the brain, there would be a stroke. When they obstruct the arteries that supplies the heart, that could result in a heart attack. So one of the ways to prevent a stroke is to maintain a healthy weight. Number two, exercise regularly. This cannot be emphasized enough. So in other words, you are being asked to avoid a sedentary lifestyle. Maybe when you go to your office, you sit for a long period of time on your system, on your phone, try to move around. It is recommended that an adult get at least 2.5 hours of moderate intensity exercise every week. I don't think that is too much. 2.5 hours, that's about 150 minutes. So if you divide 150 minutes by a week, that's about between 20 to 30 minutes of exercise daily. That's just moderate intensity aerobic exercise like cycling, jogging, brisk walking could be saving your heart from a stroke or even from high blood pressure. Because what happens is this: when you are physically inactive, just like in the case of obesity, it could cause all this fat to also build up within the walls of the arteries, and this over time could lead to the obstruction of these arteries, leading to reduced blood supply or lack of blood supply to the brain, hence leading to a stroke. Also, you've heard it, exercise regularly. It helps your heart to function properly. It helps to prevent the buildup of all these fats and other substances that could obstruct the flow of blood to your brain. Number three, quit smoking. Smoking is a risk factor for high blood pressure and consequently stroke. And when I'm talking about smoking, I'm talking about people who smoke directly and people who are second-hand smokers, passive smokers. Maybe, for instance, you sit around people who smoke. You are a second-hand smoker. If you consistently sit around people who smoke, so quit smoking, avoid being a second-hand smoker as well, because one of the ways by which smoking could predispose to high blood pressure and then stroke is by thickening or narrowing the walls of the arteries that supplies your brain. So the more you smoke, the more thickened and narrowed these arteries are. The arteries, for instance, compared to a pipe that is used to pump water. If this pipe is become narrowed or thickened, then the force of the water coming out will be reduced. And at a time when the narrowing increases and it's difficult for water to pass through, you will not be able to get water on the outside because the narrowing or the thickening of the pipes had made the pipes to come together so that water cannot flow out. That's the same thing that happens when you smoke. It causes the arteries to thicken and narrow, and consequently, this narrowing will obstruct the flow of blood to the brain, leading to a stroke. Number 4, limit the consumption of dietary sodium. More often than not, where you get sodium from is from the salt that you eat. So reduce the consumption of salt to the minimum amount that should be eaten in a day, and then reduce the amount of salted foods that you consume, junk food, processed foods, and a lot of other foods that are made with more than required amount of salt. Number 5, limit the consumption of sugar. Sugary drinks, sugary foods, they are also a risk factor to stroke because they could lead to weight gain, and weight gain could predispose you to high blood pressure and consequently to a stroke. So reduce the consumption of sugar, especially from carbonated drinks, sweetened beverages, confectionaries, amongst others. And then the next one is get adequate sleep. It is recommended that adults get at least 7 to 9 hours of sleep daily. So make sure you are getting adequate sleep. And the next one is limit stress. Yeah, limit stress as much as possible. Stress predisposes you to high blood pressure and also, to a stroke if care is not taken. So limit stress as much as possible, and then eat healthily. Eat a well-balanced diet. Avoid eating fatty foods that could cause fat to be built up in the walls of your arteries. Avoid the chunks, avoid fried food. Take more of fruits and vegetables, more of fibrous food that would help you, help your heart, and help your whole metabolism altogether. Then, high blood pressure. High blood pressure is the biggest risk factor for a stroke. Therefore, if you have been diagnosed with high blood pressure, make sure you stick to your doctor's regimen of treatment, either through medications, lifestyle modifications, and if you do not even have high blood pressure, but you have family history of high blood pressure, speak to your doctors early about this and ensure that you get regular medical checkups in order to keep your blood pressure within the normal range at all times. Then, diabetes. If you are diabetic, stick to your doctor's regimen of treatment through medications, through lifestyle modifications in order to keep your blood sugar under control. Ensure you get regular blood sugar check to keep your blood sugar within the normal range at all times. Also, and lastly for this video, maintain a healthy cholesterol level, because cholesterol when in excess could build up within the walls of the artery, obstructing the flow of blood to the brain and consequently causing a stroke. Therefore, maintain a healthy cholesterol level by avoiding foods that could predispose to you having excess cholesterol, like fatty foods, fried food. Eat more of good fat like avocado, salmon fish, lean meat, certain nuts, amongst others. Eat a lot of fruits and vegetables. So we stop here for today. I hope you have been able to learn something about how to modify your lifestyle in order to prevent a stroke. Don't forget, a stroke should not be treated with levity. Thanks for watching. Do not forget to subscribe, like, and share this video so more people could benefit from it. Till next time, Dr. Ayu truly cares about you. Bye.